It is June 9th, 2020. And as of today, we report 769 deaths. Some of you may realize that we reported 770 deaths yesterday. So we did get some new, goodness gracious, 769 cases. And some of you may have noticed that we reported 770 cases yesterday. We did get a few new cases today, but we also had to back out some cases that essentially belonged in another county. So there's always within our system sometimes some adjustments like that that have to be made relative to residency and assigning cases to any particular county. And that is why that happened today. We are reporting 28 deaths. We did have one death reported today that occurred yesterday. We have 2 inpatient at the hospital, no one in ICU at this point in time. 304 people still recovering outpatient, 435 recovered, a case fatality rate, again, always based on confirmed positives, 3.6%. We have monitored 891 individuals in terms of completing those monitors and still are actively monitoring 57. So if you look at that, basically in a breakdown by this pie chart, we have 56.6% recovered, 39.5% at home, none in the ICU, less than 1% in the hospital, and 3.6% deceased. So our ongoing hospitalization numbers, as you have seen, this graph is probably getting kind of boring to you since basically we just kind of sit here hovering down in this less than 5 number and have ever since the 7th of May. But that is a tremendously good sign in terms of what we've done to ensure that our hospital systems have the capacity as we move forward and anticipate, upticks and those sorts of things as we continue moving forward. So if those things happen, we have really set our hospitals up between the preparedness, experience with the virus, experience treating the virus, as well as getting those hospitalization numbers down so that they are not overwhelmed. The cumulative curve looks like this, so that you can see out at the end, we are definitely flattening out. The number of new cases per day tend to be fairly small at this point in time. I believe last week we averaged 7 per day. This week this last 7-day period 4. So our incidence curve just, in raw form without any kind of smoothing to help us create a curve that it doesn't jump all over the place with smaller numbers, looks like this. And then importantly, as we have increased testing, it is important to also keep track of the number of positives per day. So how many of the total tests that we are doing on any given day turn out positive. So that number has also been less than 5% since about the end of April. We turn that into a rolling average to get a better idea of what that curve looks like. And you do see that we kind of had this peak, and then we kind of peaked again. And really, even though there's been a little, kind of incidental bouncing around here, we have a downward trend here for probably also since the end of April. The blue bar, or the blue line, is our percent positives per day, also trending down for the last more than a month. Little tiny blip up here that kind of turned right back down. So that's where we are in percent positives per day. As those numbers get really, really small, you should expect to see a little bit of bouncing around. The 7-day rolling average does help smooth that sum, but generally that is a downward trend. This is what we look like by zip code, still with 48911 sitting out there fairly far ahead of many of the rest. I can tell you right now that about 30% of our Ingham County cases are in 48911 based on our current data. 48910 falling behind that, about half the number of cases. Then East Lansing 48823, Holt, Mason, as well as 48906, and then we go down from there. If we look at that in terms of cases by zip code, the darker shaded areas like 48911 that you see the most darkly shaded are areas with our most cases. And then as shading turns lighter blue and goes to green, and then even lighter green, those are our zip codes with fewer and fewer cases. We look at that by rate. Again, we quit calculating rates with cases below the number of 20 because that doesn't turn out to be very accurate. So what you see is 48911 at the highest level. Then one level below that, the little bit lighter blue, 48910 in Lansing as well as Mason. And then Okemos is where we have that next kind of darker green color, and then we go to the lighter green colors in the other Lansing zip codes as well as East Lansing and Holt. The heat map that shows basically kind of a county-wide perspective of where we have cases. You do see some very light shading over here. This is where we have minimal numbers of cases. It's the red areas, and then even more than that, the yellow areas that we're looking at. I think I've pointed this out to you before out in Okemos. This is basically due to the number of cases at Ingham County Medical Facility. It shows up as kind of a little hot spot here, but this area around here, you will see is our 48911 zip code, and then 48910 right there above it. Of course, I could have just showed you that by going straight to my zoomed in map, which makes it a little easier to see. So again, you can see multiple hotspots in 48911, hotspots as well in 48910, and some other zip codes within the city, a couple of little spots out in East Lansing, as well as heading out towards the airport there on North Grand River. We are right now 50-50, 50% male, 50% female in our cases by percent. By age group, 18% in the 30 to 39 is our kind of leading age group, 17, 15, 16%, and some of those age groups around it. So, you know, those have been staying fairly consistent. We see a little differences in those, and then we definitely see that drastic tapering off in our younger age groups as well as our older age groups. When we're calculating by percent, some of that does have to do with the fact that there are fewer people in those age groups. If we calculated this by rate, it might look just a little bit different. But we do know that predominantly this is hitting in terms of actual illnesses or cases anywhere from 20 up until 59 or 60. And then you'll see a different trend as we move on and see our deaths. So going into 48911, percent confirmed COVID cases by age group, a little bit of a different picture. As we've been saying, it has been skewing a little bit younger. You can even see in these lower age groups here, you know, these numbers are a little higher than we were seeing over there, as well as 15%, 20%, 30 to 39, and then dropping off from there. If we look at our percent confirmed COVID cases by race countywide, it's 47% Caucasian, 28% Black or African American, 15% Asian, 5% other, 4% unknown. We look at that in our 48911 zip code in terms of percent COVID-19 cases by race, and we are 37.7% Asian, 32.5% Black, 21.1% Caucasian, 4.4% other, as well as unknown. Turning those over into a prevalence rate, we look at countywide, a prevalence rate under our other category is 689, Asian 624, African American 654, and Caucasians 169. That means that we have 3.9 times the number of African Americans in terms of prevalence rate impacted, 3.7 times the number of Asians by prevalence rate impacted in our community, and 4.1% other. Looking at that in 48911, we see that other at 227, Caucasian 215, Black 667, Asian 3,905. So other just a little over 1 times, 1.1 times Caucasian. Our Black population there is 3 times more, cases are 3 times more prevalent, and our cases in our Asian population in 48911, 18 times what we see in our Caucasian population. Looking at cases by ethnicity, 84.7% are not Hispanic or Latino, 11.2% Hispanic or Latino, 4.2% unknown. That prevalence rate then looks like this, where we have 241.4 not Hispanic or Latino and 372.9 Hispanic or Latino. And I didn't do that math for you before I got on here. So somebody else divide real quickly while I keep going. So anyway, so getting to our deaths. So right now we have 14.3% of our deaths at the ages of 50 to 59. We have 17.9% of our deaths at 60 to 69, 28.6% at 70 to 79, and 39.3% over 80. So you can see what I was saying is that percentage of cases when we look at deaths is very much different than what the percentage of cases is when we see just infection across or transmission or cases, confirmed cases across the community. So as we saw earlier on with this, I mean, way back in the early days when we were looking at what was happening in China before it even got here, and then it continued to spread across the world and into the United States, that over 70 and then particularly over 80 age group is particularly at risk of death from COVID-19. Cases, deaths by sex, 53.6% male, 46.4% female. If we look at that by race, 60.7% of our cases our deaths are Caucasian, 32.1% African American, and 7.1% other. Now to ethnicity, 85.7% are not Hispanic or Latino, 7.1% are Hispanic or Latino, and we still have about 7.1% unknown. And I believe that is the end of the data. So happy to take questions, talk to you about what's on your mind, and there we go.
I don't have any questions in the queue, so if you have a question for Linda, please go ahead. Oh, Dave Eckerly. We'll take Dave's question followed by Craig.
Hi. Hi, Linda.
Hi, Dave.
Hey, I get the death rate being very high in the 70 plus as compared to the rate of cases, but the case rate is still the second highest in that age 20 to 29. Last night, I don't know if you saw the pictures and video that circulated on social media, but in East Lansing, when a couple of major bars opened, including one that's a huge dance space, it was pretty packed. The video and pictures I saw showed people real close together, like they like to do, and not wearing masks. Give me your concern level on that right now as we quote unquote reopen.
You know, all of these things are, of course, incredibly concerning to us. You know, we have really done a great job of flattening our curve and getting into a safe place when we could reopen. And at the same time, we were hopeful that people would be cautious as they re-entered. And so I think you see a very, broad range of how people are reacting to reopening. Some folks who basically are still scared to even go out or are like, nope, not going out. And others that are like, you've been keeping me in my house all this time and this wasn't that big a deal, so now I'm gonna go back out and do my normal life. And that's gonna be very hard to control. We're gonna have to rely on our business owners really to enforce standards that are appropriate in their workplaces. A lot of the standards are really more directly in terms of orders or in terms of executive orders that make requirements are about employees. And when it comes to the public, you know, there's just a lot of, you know, hoping to keep people, you know, safe by continuing to educate, continuing to talk, hoping, you know, working with employers, working with restaurants and bars, working with all of those folks to, you know, keep those numbers down. There are capacity limits in these restaurants. And so I guess now we're going to move on to, you know, we've been doing a lot of enforcing. Enforcement hasn't always been the easiest thing in the world to do. But if we see bars and restaurants exceeding those capacity limits, then we are clearly going to have to do some enforcement procedures related to that, because that is a requirement under the executive order. So
Would that include a possible cease and desist?
yes, it sure would. And that goes to the business owner. So it is the business owners that is responsible for ensuring that they do not allow people into their facility at higher levels than what is allowed.
All right, thank you.
So thanks, Dave. Good question.
Go ahead, Craig.
Linda, as we're kind of looking at all the data that's been put together, what data points would you most be looking at if we were to start seeing a second spike in cases as the economy begins reopening?
We're basically the ones that I've been showing you in terms of, you know, how we have been flattening. You know, we're going to be looking at total number of cases per day, usually probably in 7-day increments, because a day, you know, it can be an anomaly. So what have been our average number of new cases reported per day over a 7-day period? That's one. We need to look at, because again, we have to always consider how much testing is going on, given expanded testing capacity, which we will continue. So as cases go up, we still need to take into mind, is that because more testing is being done, or is that because there truly are more cases? The other thing we need to start, you know, we will pay attention to is basically what's happening with surge in our hospitals. Are we starting to pick up in terms of the number of hospitals, the number of ICU, you know, placements that are required, those sorts of things. So it is really just kind of a metric of all of those things. And I kind of shared that dashboard with you last year that we have, or not last year, but last week, that we have to look at for that. So, you know, those are kind of the three main metrics that we would look at to tell us that we are kind of looking at an uptick in cases. That's fairly easy to respond to early on, now that we've got a pretty good handle on this. So we would hope to be able to come in, you know, as we see that beginning to start, and then try to, you know, put into place measures that is going to kind of push that back down.
Okay, go ahead, Burl.
Hey, Linda.
Burl.
And I apologize for joining late, so I hope I'm not asking you to repeat yourself. But I don't know if you got a photo I sent you earlier.
I did.
So that was, for the others who haven't seen it, a crowd shot of, and it grew after I took that picture, because I swung back through there at Harper's last night. I think on my second swing through there, I would guess there were 60, 70 people very tightly together in line trying to get into Harper's. Their patios were jammed, and you know, if tables were 6 feet apart, it didn't matter, because everybody was standing at the ends of tables crowded together. First of all, is there a warning to Harper's? Did they violate anything? Secondly, how are you going to deal with people before they even get into places?
So the line outside really is people. You know, people are told if you're not from the same household, you need to stay 6 feet apart. We have to have people basically respect that. If they don't, there's not a lot that we can do about that. So in the outdoors, that is the rule. Inside, Harper's must keep tables 6 feet apart and must stay at the capacity that they are allowed to be at. Is that I believe that's 25% right now?
I'm not sure.
I'm pretty sure it's 25%.
25, yeah.
25% or 250 whichever is smaller, I believe is where we're at. So if they do that, if they have their tables placed, and if they restrict the capacity, once again, they've done what they're supposed to do, and people are going to be people. And that is the unfortunate part of all of this, is that we do have to rely on personal responsibility as well as what we are requiring of our business owners, our restaurants, our bars, our retailers. So yes, we can go in, and if there are, 1,000 people, Harper's, I believe, holds slightly over 900 people. So, if they're packing in 500 or 600, we absolutely can do something about that. We absolutely can go out and do an inspection amongst our restaurants, and probably should be doing soon, in order to make sure that they've done these table placements as has been required by the order. Once people start to get up and walk around, and they're hovering near ends of tables, they're going to the bar to potentially be served, a drink, and they're kind of crowding together at the bar. As long as those tables are 6 feet apart, and as long as they're not over capacity, now we're dealing with just human nature and what people are, willing to abide by versus not willing to abide by. And that's what will now make it very difficult for us to manage, because it's not an enforceable, there's no enforceable action on that.
So none of the people waiting outside were wearing masks. Is that an issue? Are they in violation of anything?
They are not.
Okay.
The mask wearing is basically inside, in places where you're around, even indoors. If I'm in my own office, I don't have to wear a mask. If I go into public spaces, I have to wear a mask. Outdoors, technically, I don't have to wear a mask. It's recommended that if I wear a mask if I'm within 6 feet of people that are not from my same household. We've talked from the beginning about the fact that masks, even when they were required, and I'd have to read the executive orders that have been coming out more recently in terms of what the language is on that, because some of the things change. We go from musts to shoulds, we go from requireds to encouraged, and keeping up with all that language can be a bit challenging. But never has there been a penalty for people, relative to failing to wear masks. The enforcement of mask wearing in terms of requirement falls under the safeguards, the executive orders that are safeguards that are required in workplaces. So that is where we can go in and require mask wearing. Follow up and go in, and if they're still not requiring mask wearing, usually at the counter, register. So it's not even all employees, but it's those that are interacting closely with the public, and we can do cease and desist there as well. So that is required of employers. The public kind of has the option to wear a mask or not wear a mask. Highly encouraged. Words might be required, but there's no enforcement of the word require if it exists.
All right. Thank you.
Mm-hmm. Thank you, bro.
Does anyone else have a question? Go ahead, Craig.
This is somewhat COVID related. I know with parks and a lot of recreation facilities being closed, and MDHHS last week announced that they had found a first West Nile virus in a captive hawk. To what extent are you concerned that with pest control and park maintenance and the rainfall, that we're going to see a higher prevalence of mosquito-borne illness this season?
Well, let me tell you a few things. One, observationally, I've been outside a few times myself. In a park. I was in a park in Mason. I was walking around the fairgrounds in Mason because they had to do a walkthrough over an event that they were talking about there. And it does appear, anecdotally, from my own personal experience, that we seem to be having a high-level mosquito season. Okay. That said, the vast majority of mosquito-borne illnesses are really actually quite rare. So while we might find one in a bird or whatever, the human cases, the likelihood of seeing more than a handful is pretty unlikely. Although obviously the more mosquitoes, the more likely that is. Let's keep in mind that West Nile virus, even if a person gets it, about 80% of people that get West Nile virus will have no symptoms at all. About another, not quite 20%, will have some mild kind of flu-like symptoms for say 2 or 3 days. At this point in time, they might be concerned that they have COVID or something like that. And basically those symptoms resolve very simply within a few days at home with basic home care, fluids, those sorts of things. And it's a very, very small percent of people that get seriously ill with what we call West Nile encephalitis. So having West Nile virus and having West Nile encephalitis are fairly different things. So that is a less than 1% thing. So yeah, it's a concern. We do need to start encouraging people as we, try to do most years. We have ticks here too. We know Lyme disease is kind of moving its way, this way as well. It used to be more in the Southwest area, to protect themselves against mosquitoes, dusk and dawn, wearing long sleeves, long pants, using the appropriate mosquito repellent, making sure that there's not standing water in your bird baths, your gutters, your things like that. So we need to get those messages out. I'm not concerned of a huge number of cases, but again, it can be a serious illness in somebody who has a case. And so prevention is the best way to go.